Hello everybody, myself Dr. Vipul Aghara. Today I am sharing with you some children cases solved using MacRepertory and reference work. Case 1. A 5-year-old female child came to clinic with her father. Her father told that she was having complaints of sudden unconsciousness since last 1 year. Every time she become unconscious and her body get tightened like a wood. Then her father carry her on his shoulder and punch on her back. After then she vomits and become conscious with the complaining of vertigo. Allopathic doctor investigated but didn't found any pathological cause. During case taking, whenever I was asking to the child, then every time she smiled and looked at her father. Again I asked the child what was happening. Again she smiled and looked at her father and whispered into his ear. She was so shy in nature and not giving answer directly to me. But whatever I was asking to her regarding her chief complaints, her choice, nature, likes, dislikes, cravings, fears, dreams, etc., she was giving information by whispering into her father's ear. So she always complained vertigo after unconsciousness. So this was my early case when this software was new and I was very excited. So I make a search in reference work like directly vertigo within 3 words unconsciousness within 3 words after. Then one prominent observation that every time child whisper into her father ears. Okay, so simply I put whisper, then on enter 12 medicine comes up: carbovage, arsenic, silica, aconite, bryonia, camphor, causticum, nux vomica, phosphorus, sulfur, tabacum. Then I had gone through all the references of each remedy. Then I come to know that in silica, in a book of Morrison, given that instead he whispers his response to the mother, and I click on that. Here, in children, Morrison in characteristic section, again he may be very shy in the office, refusing to answer any questions. Instead, he whispers his response to the mother, who must then relay the information to the prescriber. So this is what child is doing in my office. Then this was the search. And silica cured her, and after then complaints never returned. We are also dealing with the cases of mentally challenged children who are having causation in their pregnancy or in birth process or vaccines. In this type of cases where it's difficult to find out the true portrait of the disease because they cannot express subjective feelings or any symptoms, but we just find objective signs or symptoms in the form of repeated movements or actions and different behaviors. And these behaviors are mere expressions of internally deranged vital force, but the language is missing, that is verbal language is missing, and mostly selection of medicine on the basis of behaviors which are interpreted by us mostly failed. At that time the role of the software MacRepertory and reference work comes into play, because it is enriched with lots of latest research works and authentic reliable sources. For example, in this case, case 2, case of 10 years old girl diagnosed as ADHD. She started her talk that likes pav bhaji, spicy chili, samosa. Then she stopped narrating. Her mother said sometimes she become hyper and angry. Previously she used to strike even. She doesn't like to go in crowds, wants to remain at home. She always insists to go home when she is outside. She likes to watch television. She always speaks in dialogues of characters like Shaktiman, Chota Bheem, Doraemon. They were cartoons. She is having a fear of ghosts and darkness, high places. She shouts and screams in sleep and also on waking. She is having a complaint of bedwetting at night. She is very sensitive. When she sees others are weeping, she starts weeping. On asking about herself, she said, there is a big village. In that there are many houses. Inside there are big ghosts. So much fearful. She keep repeating above story in Hindi. Like, एक गांव होता है बड़ा बड़ा, उसमें बहुत बड़े बड़े घर रहते हैं, घर के अंदर बहुत बड़े बड़े भूत रहते हैं, बहुत डर लगता है. On asking further, there are ghosts, dinosaurs, vampires, chocolate monsters, so much afraid. आगे भी वो हिंदी में बोलती है, बहुत भूत रहते हैं, डायनासोर्स रहते हैं, बड़ी आंखें रहती है, वैम्पायर्स रहते हैं, चॉकलेट मॉन्स्टर्स रहते हैं, बहुत डर लगता है. So she repeat this even in home, even in school, every time. History of convulsion during malaria. Our observations are, she is chubby in look, and every time on asking, she takes a long time before answering. So here we taken some rubrics. I will show you in MacRepertory. So we have taken these many rubrics, like mind, homesickness, nostalgia, fear high places, fear evil, desire spices, involuntary urination at night, fear dark, obstinate headstrong children, fear ghosts, seeking shouting waking on, seeking shouting sleep during, then weeping tearful mood sleep during, imitation mimicry, pepper desire. So by the story and the theme of her issues, we decided plant and solanacy. But on the repertorization chart, we found these remedies: lyco, calcarea, causticum, hyo, carcinosinum, sulfur. But often we found that if you already decide theme, kingdom, sub-kingdom or family, then this strategy, here is a strategy, left side bottom, you convert this strategy from number of rubrics into prominent remedies, and it always works. So first medicine comes is capsicum, and we were excited that in ADHD child remedy comes is capsicum. Then I also searched in reference work. We always utilize reference works in its fullest possibility. So we simply put here ADHD and enter. So what comes in 14 medicine of ADHD given in reference works? There are the aspartame, amphetamine, oromio, natronatrum, biotaphos, benzoic acid, calcareaphos, capsicum, heloderma, hyo, medorinum, tarantula, thuza, zincum sulf. So surprise is that capsicum is given in these 14 remedies. So here, if we read references, this is a rubric given in complete repertory clinical section. Then I search in clinical, attention deficit hyperactive disorder ADHD. 10 remedies given in repertory and 14 medicines are given in reference works. So here also capsicum is given, but the source is the author Richenberg and Ullman. Then we have to know the source also, how much it is reliable. So we go to his book, Richenberg Ullman cases. A book is given in Mathematica reference for. Then capsicum. In book they are given a case of a 5-year child of ADHD, and if we see their analysis of their case, what is interesting is that what it written like: we use the following rubrics from the mind section of the complete repertory: discontent and fear of being censured, homesickness, absent-minded, brooding, disobedient, obstinate, reflex, long, restlessness, busy, and homesickness. And the remedy prescribed capsicum 1 m. So from this data we were sure that capsicum will work, because we already have a case in our literature and cure cases of an authentic author, from authentic author. So capsicum comes in repertorization, and I search ADHD, and the source is Richenberg Ullman books, and this is their analysis. And what is interesting, that neurophysician and psychiatrist told her parents that bridge in her brain, that is the part of corpus callosum, is not developed and she will remain same for the whole life. In short, no medicine available in allopathy for developing the bridge. But follow-up shows so improvement that it shuts the mouth of these fellows and created a smile on his parents' face. First dose of capsicum 200 stopped the bedwetting and fear of darkness and ghost. The whole talk of the characters, vampires and monsters and all in terms of evils, disappeared. And surprisingly, she got first prize in the dance competition in school within only 3-4 months of treatment. So it is not the end of the case. During the first interview, her mother didn't told us some peculiar symptoms which were coming intermittently, and these were severe pain in abdomen with bloating at lower part of abdomen, with nausea and occasional vomiting and less frequent micturition. And every time when they consulted to physician on examination found nothing. So after 1 month of treatment, she came with these same complaints, and we repeated 1 dose of capsicum 1 m, which relieved her. Since then, intensity and frequency of these complaints decreases. After 6 months of follow-ups, we were again re-evaluating the case. Her mother gave us history of pregnil injections taken for conceiving this child because she was having problems with ovarian follicles which were not maturing properly. So we found that pregnil contains the hormone HCG, and it was a pleasure of having information regarding human gonadotropin hormone in our reference work. I will show you. This is the hormone chorionic gonadotropin as a medicine. When we click, only books is available is Mars Clinical Drug Pictures, and in female section he is given that ovarian hyperstimulation syndrome, that severe abdominal or stomach pain, feeling of indigestion, moderate to severe bloating, decreased amount of urine, continuing or severe nausea, vomiting or diarrhea, and severe pelvic pain, rapid weight gain, shortness of breath, swelling of lower legs. So we also surprised that this may be the effect of SCG taken by her mother for conceiving pregnancy. So at present overall she is 70% better, but if in future progress will stop or stuck, then we can prescribe SCG in homeopathic potency to complete the cure. So this way software always validate our prescription and boost our confidence. Case 3. A case of 9-year-old male, child having a complaint of epilepsy since 9 months of age. Also operated for a cataract in both the eyes. Diagnosis is microcephaly, nystagmus in the both eyes, epilepsy and developmental delay. Mother history. After her marriage, she had a frequent abortion and she was unable to conceive for 5 to 6 years. After then, she had taken treatment for conceiving pregnancy for 1.5 years. At 4th month of her pregnancy, her USG shows that child was not normal, and doctor suggested for abortion, but parent decided to have a child. Now child history, he is hyperactive, epilepsy every morning, petit mal type, shrieking and shouting, moving in a circle, pulling hair of others, beating others, fear of sudden noises, especially balloon. This is very strong symptom, striking symptom, because his mother always keep balloon to control his behavior. Making noises of running train. Our observations are twitching of face and especially under left eye, movement of hands around face, speech stammering, making faces like grimaces, and stamping of feet. And history of operated for cataract, both eyes, and also taken treatment for breathing difficulty at the age of 2 years. And every time he was getting fever after each vaccination shot. So this is the important data about this case. We taken some rubrics like fear, noise from sudden, stammering speech, microcephaly, head microcephaly, convulsion, spasm children in, and mind grimaces. All the rubrics covered by first medicine, that is DPT. We can take some other rubrics also, but here DPT comes very prominently. It covers all the rubrics, all the 5 rubrics, which are very striking in the case. Then after correlating with the history of child, we understood that DPT vaccine might be the causative factor of epilepsy at 9 months, eye symptoms, speech problems, and other developmental delay. All this information concluded that child was already retarded, but after sorts of DPT, epilepsy and other defects in eye, speech, etc. developed. Then I also made a search on reference work, like we have a microcephaly. I used to always search a diagnosed condition in this magic box, because it gives a reference of cure cases and all this. So such microcephaly, within same remedy, petit mal. then result comes is only medicine DPT. If we read in Murphy, DPT vaccine, in clinical anorexia, brain damage, autism, attention deficit, epilepsy, right? Coughs, cry-encephaly, respiratory distress, speech disorders, tremors. And if you read the DPT in Murphy, DPT, this vaccine contained formaldehyde, a mercury derivative, and aluminum phosphate, and was incubated in animals' entrails. Can attack the damage the immune and nervous system. DPT vaccines have been linked to sudden infant death, brain damage, autism, blindness, epilepsy, and death, learning disability and hyperactivity in children, fever, febrile convulsions, seizures, and diarrhea, tendency to colds, flush, earache, sore throat, etc. All the symptoms like brain damage, coma, seizures, blindness, dyslexia, visual perception problems, auditory processing deficit, fine motor delay, and attention span deficit, learning disability. In mind section, brain damaged children, learning disability, autism, dyslexia, unable to sit still for more than a few minutes, cries easily without warning, screaming, temper tantrums. Right? In eyes twitching, visual perception problems, hallucinations, blindness, and causation return is reactions to DPT vaccine, right? In also respiratory distress, speech disorders, in a mouse section given speech disorders. So if you read in one journal SOH Homeopath, given in mind section, although many of these children exhibited a tubercular diathesis and later were prescribed tuberculinum, temper tantrums do seem to be a symptom of DPT as well. Many of the symptoms associated with the hyperactive behavior were changed by DPT: biting, stamping feet, that are found in our case, waving arms about hyperactivity. Equally, symptoms of the other extreme were represented: thumb sucking, lacking confidence, low energy. DPT in potency often showed a marked change that could be described as taking the lead off. That maybe the vaccine blocked the brain socially, emotionally, or intellectually, right? The DPT vaccine removes that block. So this is Serge, this is Murphy, and one peculiar symptom of the case is a fever after each vaccination. And 3 medicines are given, that is DPT, Thuja, and carcinosin. So definitely we prescribed DPT according to the on the basis of potency, and repetition was selected on the basis of work of Dr. Tina Smith, who had given 300 cure cases of ASD in his book Autism Beyond Despair. So prescription was DPT 30 twice in the first week, DPT 200 twice in the second week, DPT 1m twice in the third week, and 10m twice in the fourth week. If any given dose elicit any reactions such as a fever, cold, coryza, diarrhea, or increase in hyperactivity, then wait until the reaction disappear and do not repeat the next potency. This is the condition given in book by Tina Smith. In follow-up, DPT 1m had produced diarrhea and increased the hyperactivity, so we had not repeated 1m until reaction subsided. His intellectual abilities in general increased, grimaces less, speech become clear, epileptic attacks become less frequent, and in last 8 months he is improving well in social, emotional, or intellectual levels, and epileptic attacks become occasional and of less intensity. So in reference works we experience lots of latest researches that it helps in our practice for prescribing newer remedies with confidence. Okay, thank you very much.